What are the symptoms of vitamin D deficiency? How much vitamin D do you need? And can you overdose on vitamin D and get vitamin D toxicity? The answer coming up. Soonkie. Hi everybody, it's your Pharmacist Soonkie here. Today we're going to be talking about the symptoms of vitamin D deficiency, how much do we need, and toxicity levels of vitamin D. This channel is dedicated to better your health. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up, and follow me on Facebook and Instagram. My handle is @SoonkieOfficial. Now without further ado, let's rock it. Vitamin D is a fat-soluble vitamin and it is a steroid hormone that is made in our skin upon the exposure to sunlight's UVB radiation. It helps our body to absorb calcium to keep our bones and muscles strong and healthy. Besides that, there are researchers that shows that there are links between low vitamin D levels with diseases such as colorectal cancer, heart diseases, diabetes, depression, chronic fatigue, multiple sclerosis, autoimmune diseases, asthma, respiratory infections, and the list goes on. Unfortunately, most people experience no symptoms with vitamin D deficiency. Some people may experience some muscle pain, fatigue, or weaknesses. But majority of the people will only find out that they are vitamin D deficient when something happens, when they get a fracture. In other words, it's hard for someone to find out that they are vitamin D deficient unless they get a blood test done. I've made another video about who are at risk of vitamin D deficiency, and these are the people who need to get a blood test done. I'll put the link down below for you so you can watch it later. So how much vitamin D do you need? Now, dependent on your age, the recommended doses varies. Vitamin D is measured in micrograms or IU, International Unit. Now, this is the recommended daily intake of vitamin D. From birth to 12 months, 10 micrograms, 400 IU. Children from 1 year old to adult 70-year-old, 15 microgram, 600 IU. Adults 71 years old and older, 20 micrograms, 800 IU. Pregnant and breastfeeding women, 15 microgram, 600 IU. Now, can we get too much vitamin D? Yes, we can, and often this happens when we overconsume vitamin D supplements. When amounts in the blood becomes too high, signs of toxicity happens. Signs of toxicity includes nausea, vomiting, poor appetite, constipation, weaknesses, and weight loss. Too much vitamin D raises too much calcium as well, which can lead to confusion, disorientation, and problems with heart rhythm. Excess vitamin D can also damage the kidneys. The daily upper limit for vitamin D is 25 microgram to 38 microgram, 1000 to 1500 IU for infants, 63 to 75 microgram, which is 2500 to 3000 IU for children of 1 to 8 years old. 100 microgram, which is 4000 IU for children 9 years and above, adults, and pregnant and lactating teens and women. Vitamin D toxicity almost always occurs from overuse of supplements. Excessive sun exposure doesn't cause vitamin D toxicity because the body limits the amount of vitamin D it produces. Having said that, we talked about this before. We should not intentionally expose our skin to the sun for the sake of getting vitamin D due to the risk of getting skin cancer. I talk more about other vitamin D topics in my other videos, such as types of food that contains vitamin D. I'll put the links down below for you. Now, one extra tip. I recommend that if you have already hit 30 years of age, you will see your doctor at least once a year to get a full body checkup and a full blood test done to make sure that everything is alright. I hope this video is of value to you. Please share it and tag it to your friends and family. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up, and follow me on Facebook and Instagram. My handle is @SoonkieOfficial. Now it's a Pharmacist Soonkie here with lots of love. See you around.